Hello, my name is Matthew Harris and welcome to my presentation on common neurological signs and symptoms. Neurological impairments can be broken down into three main categories: motor, sensitive and cognitive. A majority of clients will suffer from composite impairments and will have more than one issue. This can be across multiple areas of neurological conditions as well as other musculoskeletal or psychological conditions. Sensory impairments affect the body's data collection for reactions to both internal and external stimuluses. Injury to one of these areas may affect both the quality or the quantity of the data collected. Sensory signals travel along the afferent pathway, from nerves in the peripheral system up the spinal cord into the brainstem, and then to either the parietal, occipital, or temporal lobe, depending on what type of signal has been collected. There are several areas that can be impacted by sensory impairments. These include the visual system for receptors in the eyes in the occipital lobe, the vestibular system receptors in the ears for hearing and balance in the temporal lobe, the sensory receptors in the skin for touch and pressure vibration in the parietal lobe, as well as musculoskeletal receptors and joint receptors, which help in coordination, proprioception, changes in muscle length, and monitoring force. So how does damage to the sensory system affect motor control? Damage to the sensory system can affect locomotion in terms of reactive strategies and receiving feedback from external stimuluses, as well as proactive strategies where you can predict obstacles that may occur. Damage to the sensory system can also affect the gait and can often be presented as stamping of a foot to create a feeling of the foot touching the ground, as well as postural control, creating abnormal postural sway and a loss of anticipatory postural control. So how does this affect us? There are two major strategies we can use in the rehabilitation of sensory impairments. Habituation is used to decrease responsiveness if there is damage that has caused an increase, whereas sensitization is the opposite. It's used to increase responsiveness if damage has caused a reduction. Damage to the sensory tracts, somatosensory cortex, sensory receptors, and the visual and vestibular system can cause major impairments to the individual. An assessment of these impairments corresponds to the damaged area. For example, you've got head movements for vestibular system damage, or dermatomes for peripheral nerve distribution, or for sensory receptors in the skin. Impairments to the somatosensory system will impact motor learning, as the action will be learned with incorrect motor inputs. It follows that successful execution of motor tasks require concurrent sensory feedback that is both accurate and effective. Motor impairments can be broken down into four main categories: abnormal muscle tone, motor weakness, coordination problems, and involuntary movements. There are four major types of abnormal muscle tone. Flaccidity is a complete loss of muscle tone. Hypotonia is a reduction in the stiffness of a muscle to lengthening, which is often seen as floppy baby syndrome. Spasticity is a velocity-dependent increase in muscle tone, and rigidity is when muscles become very stiff and is seen in conditions such as Parkinson's. Damage to the corticospinal tract, cortico-reticular and dorsal reticulospinal tract, cerebellum, and muscle spindles and spinal tract often create these abnormal muscle tones. Muscle spindles generate muscle tone by activating the stretch reflex, and the cerebellum inhibits muscle tone indirectly through the inhibition of gamma motor neurons, while cerebellar lesions commonly produce hypertonia. This is seen in several motor areas, the most common of which include gait, which is seen in many conditions such as spastic hemiplegic gait, spastic paraplegic gait, and cerebellar gait. It also can affect people's posture, in particular forward flex type posture, which is common in Parkinson's disease. There are several ways to test for abnormal muscle tone. This can be done through observation, the modified Ashworth scale, as well as the Tardieu's test. Treatment of abnormal muscle tones can be done in several ways and often will include multiple. Pharmacological treatments are common in abnormal muscle tone, as well as surgical rehabilitation. Physical rehabilitation is common and is most likely to be our area of expertise, as well as the positioning of the client in order to reduce contractures and minimize the effect of abnormal muscle tone. Motor weakness is the inability of the muscle to generate its normal force. This leads to a reduction in the peak force of the muscle. This occurs when there is damage to areas that help you move, such as the primary motor cortex or the corticospinal tract. When the brain cannot send proper signals to the muscles, it is harder for them to work properly. People with these motor impairments may experience struggles to start a movement, experience less strength, or may show poor coordination. The brain is able to relearn movements through repetition of meaningful tasks, task-specific training, feedback, as well as constraint-induced movement therapy. People suffering from motor weaknesses can present as including hemiparesis, paraparesis, or general flaccid or spastic movements. This can be assessed through upper and lower limb force production, including manual muscle testing and grip strength dynamometry, and also fatigue rating scales. Motor impairments create difficulties that make it hard for people to do basic daily tasks, including transfers and standing up from sitting down positions, as well as grasping other objects, which can lead to dependence and elevated risk of falls. Task-specific training combined with resistance training is an effective way of treating motor weakness and encouraging the brain to relearn movements. Coordination problems are stereotypical patterns of movements that cannot be changed or adapted to changes in the task or environmental demands. It can occur when there is damage to areas such as the cerebellum, frontal lobe, brainstem, spinal cord, or basal ganglia. In normal movement, the central pattern generator has descending drive which comes from the brain and initiates gait and coordinated movement patterns. There are several signs and symptoms of coordination problems, including apraxia, akinesia, dyskinesia, ataxia, and dysdiakinesia. In clients with impairments to these areas, it is common to present with things such as hip hiking, Trendelenburg gait, foot drop, hemiplegic gait, or ataxic gait. This can be assessed in many ways, including balance assessments, functional movement assessments, as well as non-equilibrium testing. Treatment of these conditions may include management of fine and gross motor tasks, dual tasks, as well as time tasks, testing reaction time and accuracy of movements. Involuntary movements are unintentional movements of another limb and occur due to damage in areas such as the basal ganglia, subthalamic nucleus, cerebellum, or corticobasal thalamic loops. Involuntary movements occur due to things such as disinhibition of motor circuits, altered dopamine levels, abnormal brain signals or firing patterns, and genetic mutations. Involuntary movements affect movements due to uncontrolled, unwanted movements during action or even at rest. This impairs task accuracy, timing, and stability, and can lead to fatigue and frustration due to movement unpredictability. Compensatory strategies are often required for such as focusing on external cues or bracing, and clients present with resting tremors as well as intention tremors, chorea, and dystonia. This can be treated in many ways, including rhythmic auditory cueing, external focus or attention, as well as pharmacological support. Cognitive impairments affect the brain's ability to process, sort, and retrieve information. There are several structures in the brain that contribute to cognition. These are in the cerebral cortex, including the frontal lobe, parietal lobe, occipital lobe, and temporal lobe, as well as the limbic system in the amygdala, hippocampus, and entorhinal cortex. Cognitive functions such as planning and decision making are deeply integrated with motor control mechanisms, influencing how movements are initiated and executed. This is particularly evident in motor imagery, which is used to study the planning and representation of movements in the brain. The brain anticipates and sequences movements over time to achieve coordinated actions. The cerebral cortex is the most important structure in cognition due to its functional areas. Important areas in the cerebral cortex include the prefrontal area, Wernicke speech areas, the secondary sensory area, secondary auditory area, as well as the secondary visual area, and the higher visual association area. There are several signs and symptoms of cognitive impairments, such as memory impairments, attention deficits, executive dysfunction, language and communication issues, as well as visuospatial impairments. Cognitive impairments show up in diseases such as memory loss diseases, including Alzheimer's and several types of dementia, as well as diseases such as Parkinson's, Huntington, and prion disease. Assessment of cognitive impairments can be done through attention, concentration, and information processing, visuospatial or constructual and perceptual skills, language, executive function, social cognition, and praxis. While treatment of cognitive impairments can be done through pharmacological therapies, environmental, psychological, and behavioral interventions. Thank you for watching in on my presentation on common neurological signs and symptoms.